Hi, I'm Dr. Dave. Ataxia is a neurological sign and symptom consisting of gross lack of coordination of muscle movements. Ataxia is a nonspecific clinical manifestation implying dysfunction of parts of the nervous system that coordinate movement, such as the cerebellum. Several possible causes exist for these patterns of neurological dysfunction. The term dystaxia is rarely used as a synonym. The term cerebellar ataxia is employed to indicate ataxia due to dysfunction of the cerebellum. This causes a variety of elementary neurological deficits, such as antagonist hypotonia, asynergy, dysmetria, dyschronometria, and dysdiadochokinesia. How and where these abnormalities manifest depend on which cerebellar structures are lesioned, and whether the lesion is bilateral or unilateral. Vestibulocerebellar dysfunction is related to the flocculonodular lobe, flocculus and nodulus, and involves problems regulating balance and controlling eye movements. This presents with postural instability, in which the person tends to separate the feet on standing to gain a wider base, and avoid oscillations, especially posterior-anterior ones. Instability is therefore worsened when standing with the feet together, irrespective of whether the eyes are open or closed. This is a negative Romberg's test. Spinocerebellar dysfunction, the most serious of all forms, corresponds to the vermis and paravermis and presents with a wide-based drunken sailor gait, characterized by uncertain starting-stop, lateral deviations, and unequal steps. This part of the cerebellum regulates body and limb movements. Cerebrocerebellar dysfunction indicates a lesion of the deep pontine nuclei connections with the cerebellum, which coordinates planning and monitoring of movements and presents with disturbances in carrying out voluntary, planned movements, including intention tremor, coarse trembling, accentuated over the execution of voluntary movements, possibly involving the head and eyes as well as the limbs and torso. Peculiar writing abnormalities, large, unequal letters, irregular underlining, and a peculiar pattern of dysarthria. Slurred speech, sometimes characterized by explosive variations in voice intensity despite a regular rhythm. The term sensory ataxia is employed to indicate ataxia due to loss of proprioception, sensitivity to joint and body part position, which generally depends on dysfunction of the dorsal columns of the spinal cord, since they carry proprioceptive information up to the brain. In some cases, the cause may instead be dysfunction of the various brain parts that receive that information, including the cerebellum, thalamus, and parietal lobes. Sensory ataxia presents with an unsteady stomping gait with heavy heel strikes, as well as postural instability that is characteristically worsened when a lack of proprioceptive input cannot be compensated by visual input, such as in poorly lit environments. Doctors can evidence this during physical examination by having the patient stand with his/her feet together and eyes shut, which will cause the patient's instability to markedly worsen, producing wide oscillations and possibly a fall. This is called a positive Romberg's test. Worsening of the finger-pointing test with the eyes closed is another feature of sensory ataxia. Also, when the patient is standing with arms and hands extended toward the examiner, if the eyes are closed, the patient's finger will tend to fall down, and be restored to the horizontal extended position by sudden extensor contractions. Ataxic hand. The term vestibular ataxia is employed to indicate ataxia due to dysfunction of the vestibular system, which in acute and unilateral cases is associated with prominent vertigo, nausea and vomiting. In slow onset, chronic bilateral cases of vestibular dysfunction, these characteristic manifestations may be absent, and disequilibrium may be the sole presentation. The term optic ataxia is used to indicate dyskinesia with eye-to-hand movements or an inability to reach and grab objects. It is part of balance syndrome but can be seen in isolation with injuries to the superior parietal lobule. It represents a disconnection between visual association cortex and the frontal premotor and motor cortex. The three types of ataxia have overlapping causes, and can therefore either coexist or occur in isolation. Any type of focal lesion of the central nervous system, such as stroke, brain tumor, multiple sclerosis, will cause the type of ataxia corresponding to the site of the lesion. Cerebellar if in the cerebellum, sensory if in the dorsal spinal cord, and rarely in the thalamus or parietal lobe. Vestibular if in the vestibular system, including the vestibular areas of the cerebral cortex. Exogenous substances that cause ataxia mainly do so because they have a depressant effect on central nervous system function. Examples include both prescription drugs, e.g. most epileptic drugs have cerebellar ataxia as a possible adverse effect, and recreational drugs, e.g. ketamine, PCP or dextromethorphan, all of which are NMDA receptor antagonists that produce a dissociative state at high doses. There is no specific treatment for ataxia. However, medicinal marijuana has been known to ease the symptoms associated with ataxia. The disability of ataxia may also be reduced by physical therapy, including exercises, along with leg braces or shoe splints. If foot alignment has been affected, a cane or walker is often used in the effort to prevent falls. Thanks for listening. Goodbye.